Good morning, everyone, and good afternoon to our friends on the east and central country parts of the country. I'm Lauren Van Schilfgaard, Tribal Law Specialist with the Tribal Law and Policy Institute, and it's my pleasure to welcome you to the webinar. So today we are very excited to be discussing the fiscal year 2019 Comprehensive Opioid Abuse Program, another great funding opportunity for tribes coming out of the Bureau of Justice Assistance. I am also happy to welcome my co-presenter, Timothy Jeffries. He is a Senior Policy Advisor with the Bureau of Justice Assistance. Hi, Tim.
Hi, Lauren. Thanks for the invite and welcome.
So Tim is going to be here as sort of our expert in-house. He helped author the solicitation and is going to be help reviewing and overseeing all of the awards that are going to be made out under the solicitation. So if you have questions about how this solicitation works, how you might want to structure some of your application, any of that, this is definitely a good place to send those questions. As my colleague Laura mentioned, we're going to be accepting questions throughout the presentation. We've devoted a good chunk of time at the end of this specifically for those questions, but Laura's going to help sort of facilitate those questions as they come. So feel free, as they come to you, use your questions bar, and we will address all of those as much as feasible. So let's
Lauren,
dive right in.
Sorry about that.
Yeah.
Sorry, this is Tim. I did want to mention, if folks, after reviewing this webinar, have questions and digest the material, there will be another webinar that we will put on April the 29th for the stateside applicants. So it'll be a great opportunity to rethink maybe some of your questions and ask at another later opportunity. So you have multiple opportunities, if you don't ask your questions today, to come back again and ask questions at the later webinar.
Great point. Such a great point. Last year, when all of these solicitations were coming out, because of the way the congressional appropriations worked out with a lot of the opioid funding, so many of these solicitations were really short. We only had 30 days from the time the solicitation opened to when we needed to submit our application. This year, there thankfully is a little bit more breathing room. So hopefully as the creative juices get flowing, we have a little more time to go back to our colleagues and sort of brainstorm what we want to do here, including digest some of these questions that we might have for a later time. So just a quick background on this particular grant. For those of you that this doesn't sound familiar, COPE, very new terminology, don't worry, it is new. This solicitation first came out in 2017 in direct response to the opioid epidemic. So we heard a lot in the media about what Congress was doing for the opioid epidemic, what the White House was doing, and this really, I think, is sort of the cumulative response to that. It was originally funded under the Comprehensive Addiction and Recovery Act, or CARA, in 2016, with the specific goals of addressing the opioid epidemic through prevention, education, and services for treatment and recovery from addiction. So it's pretty broad. But what the solicitation also did was it coupled pre-existing programs, specifically the Harold Rogers Prescription Drug Monitoring Program that comes from 2002. So instead of having two separate solicitations, both of which sort of addressed opioids, they just combined them two. So I want to talk just a little bit about that prescription drug monitoring. In some ways, tribes can technically be eligible, but the truth is it's not designed for tribes, so I'm not going to spend a whole lot of time on it. So this solicitation was released last week, April 5th, and as I mentioned, unlike last year, we have a little bit of breathing room. It's not due until June 5th. So for all of you that are exhausted from having just submitted your CTAS applications, I hope you're excited to dive right back into the grant writing world. So I'm just going to spend a little bit overviewing sort of why this grant exists. In small part, I include statistics here and some findings. If you, for example, wanted to refer to some of these statistics in your grant application, you're warmly invited to do so. But even if you don't, here's just a little background of where we're at. So back in 1999, this country had a pretty steady average of number of drug overdoses that our neighbors suffered, and that hovered around the 16 to 17,000. In the late aughts and early teens of this century, we saw a huge spike in the rate of drug overdose deaths, with it peaking last year, or in 2017, which is the last year we have the most current data on, to 70,000 people. So this is a huge spike, and we can trace most of that, as we'll see in a later slide, to opioids. So in 2014, 1.9 million Americans had a substance use disorder involving opioids, or specifically prescription pain relievers. 586,000 had a substance use disorder specifically involving heroin. I think that we know anecdotally, just in our own communities, that Natives are disproportionately overrepresented in those numbers. Another important takeaway for our purposes is that opioid use is not isolated. It's not in a silo. It affects children, families, and entire communities. So this is a neat snapshot that I just took yesterday off of the CDC website. If you click on this slide, it's hyperlinked to where I got it from, but you can also see the citation at the bottom. And if for some reason your link doesn't work, I've included a PDF of this PowerPoint along with the solicitation and the handouts that you can see on the right-hand bar of this webinar. And if for some reason you can't see those handouts, we're going to be posting this slide deck as well as the solicitation immediately after this webinar on wellnesscourts.org. And tomorrow, it takes us a couple hours, once this recording is complete, we will upload that onto our YouTube channel. So you'll be able to, one way or another, access this hyperlink. So as you can see, the overdose deaths, I noted there was a huge spike in the teens, and you can see the opioid synthetics, specifically fentanyl, representing a huge reason for that increase. Oops, I clicked on the link. Let's go back to the PowerPoint. So we have some neat data in regards specifically to American Indians, which is kind of fun. Oops, my screen has paused for some reason. Let's see if I can fix that. Sorry, everybody. My computer didn't like that I clicked on that link. That's what I get for linking it.
Lauren, I did want to mention while you're clicking on the link, I did want to mention that I've neglected to just thank the Tribal Law and Policy Institute for all the work that you're doing in the crosswalk. We recognize that so many different funding opportunities out there, so it's great on behalf of the Bureau of Justice Assistance that you are doing this. And I do want to mention to the field that as a result of the webinar that you did last year, we had 10 times more applications that came in and awards. So we only had one award that we made to a tribe in 2017, and we made more, just I believe 10 awards in 2018. So thank you again for putting this together, and as a result of this, we were able to generate a lot more interest from the tribes in our funding. So I did want to thank you for that.
Oh, well, that's so good to hear. Yeah, I know at least 3 tribes were awarded last year, which is so great. It's so great. So keep it coming, Indian country. This is our funding. Okay, so American Indian specific data. This was pulled from the National Congress of American Indians. They come out with great research policy updates. I frequently go there for my statistics. Unfortunately, the most recent data that is Native specific comes from 2015, but you can find here confirmation that yes, in fact, Natives are disproportionately overrepresented when it comes to opioid overdose deaths. A couple of good asterisks to that data is that while we know that we're overrepresented, we also know that we don't have all of the information. That's because Natives live in multiple jurisdictions, and because of the misclassification of race and ethnicity, especially on death certificates, it's just really hard to grasp what it is that we're not missing. Another important takeaway, and this has certainly played out anecdotally in my experience in traveling to different healing to wellness courses, is that there is a huge discrepancy on what communities are experiencing. For some communities, the opioid epidemic is here, it's real, and it's ravaging the community. Their entire docket for their wellness court is opioid related. Their participants might be poly users using opioids and meth or opioids and alcohol, but everyone is on opioids. Medication-assisted treatment is a huge issue, everything that accompanies. For other communities, that's not so. Meth is the predominant drug of choice. Alcohol, marijuana, the opioids, there might be one or two cases. There might be rumblings that the opioid epidemic is coming. For some communities, it's intravenous heroin. For others, it's the misuse of prescription drugs. It just totally varies. And so I think before you start making assumptions about what your community is facing, it's really important to take a look at what the data is indicating. What do our court records show? What do our treatment centers, what are they seeing? What do our hospital admissions look like? Do we have access to that data? And if we don't, maybe this grant is an opportunity to help open those lines of communication, because before we can propose some solutions, we need to know what the problem is.
Lauren, we had one clarification question, if I could jump in.
Sure.
There was a question about now back 2 slides, what the non-metropolitan statistic said. Something like 519%?
Yes.
Okay.
So, yes. So this is a statistic that was drawn from that same 2015 data that was specific to Native Americans, and it was sort of inferring this overdose increase over time, showing a non-metros. So this is for Natives that don't live in urban centers. So basically everyone else, predominantly on reservation, showed a 519% increase in drug overdose deaths. So where we saw a very large increase for the population generally, for Natives, it was astronomical, right? It's five-fold increase, truly devastating. And right at the bottom, you can find a link where I found that statistic. Thanks. Keep the clarifying questions coming. I love it. So here, I put just like a very simple slide. All of you are experts in your field and unfortunately intimately aware, but I put this up here just because I think this COPE grant is really interesting in that it's very open-ended. It provides a lot of different opportunities to address the opioid epidemic, including all of the various interrelated complex factors that lead to addiction. It's not just a matter of access to opioids, even though we know that's what's led to the epidemic. But what leads to addiction is far more complex and includes things like poverty and economic instability. It contributes to the decreased ability to parent and all of the family risk factors that leads to. It leads to a range of physical, mental, and behavioral health ailments, all of which required very different strategies for coping. It also greatly contributes to trauma, including a higher risk of exposure to violence and victimization, again, each of which requires very different strategies, often multi-factor collaborative strategies across varying agencies that themselves might not be specifically targeted to addressing opioids or even addiction, but nevertheless might be really useful partners when we think about our overall strategy. So that brings us to COPE, this solicitation. As I mentioned, it's pretty open-ended in that it wants to tackle, prevention, treatment, post, recovery, recovery support. It definitely wants to see collaborative approaches to this. It anticipates that most, if not all, of the proposals are going to include multiple different agencies that have agreed to partner. And it's narrow in the sense that it's definitely targeting those impacted by the opioid epidemic. They have a couple of objectives.
I'm sorry.
Please, go ahead, Tim.
Sorry about that. I'm glad you did mention that because as you pointed out, we have a bunch of different funding streams. So when you talk about comprehensive approach, it's not designed for one particular area because we have so many other areas like the Drug Court Discretionary Grant Program, Justice Mental Health Collaboration Program, and the ones that you mentioned under CTAS and other areas. So I'm glad you did mention that funding is available for programs that are similar to tribal healing and wellness courts, but it must have multiple different components like adding peer recovery to your tribal healing and wellness court, adding a portion of your funding for housing and transitional housing for recovery as a part of your healing and wellness court. Those are the options that we're looking at adding to your existing program structure.
Very good. And I just saw a question pop up about something that was not designed for tribes. I was referencing the prescription drug monitoring program, which is category 3 of this solicitation. I'll be mentioning it again just a little bit, so don't worry, you didn't miss anything. So here are some objectives and deliverables that this solicitation identifies for itself. These are the goals and objectives, or the objectives and deliverables for why this solicitation exists. It's certainly relevant for us as the proposal makers of, how is our proposal going to contribute to these overall objectives and deliverables, but these don't necessarily need to be yours verbatim. But it includes reducing opioid abuse and the number of overdose fatalities, mitigating the impact on crime victims, and supporting proactive use of those prescription drug monitoring programs. So I think if your proposal can in some way tie to one or two or even all 3 of these, you stand a good chance of being funded. So what's kind of funny, Tim, and I'll be interested in your opinion on this, last year's solicitation made a big fat deal about the use of this sequential intercept model. In this year's solicitation, I noticed that a lot of those references were no longer there. However, category 1 still wants you to identify where in the sequential intercept model you're going to be targeting your program. So is it true we still want to be referencing the sequential intercept model and being familiar with its different categories? Or is it something that we just need to be like, yes, we're going to be in, intercept 1, and we don't need any further references?
I'm so glad you mentioned that. We have not abandoned the concept or the notion of the sequential intercept. We do recognize the importance of it. And when we had a meeting of the minds of all the people, the special interest groups to convene and develop the solicitation, they wanted to see funding allowable under the different areas of the sequential intercept model. And for those that may not know, that includes pre-adjudication, post-adjudication, drug court areas, correctional programming, and release. So what we wanted to do was streamline this solicitation and make it easier for folks to apply. We recognized that 5, 6 categories was a lot, right? So we reduced the number of categories, but kept the notion that we recognize that you want assistance anywhere along the criminal justice entry point for clients or folks with opioid abuse. So one thing that you will notice, we no longer have those 6 categories. I believe we're down to 3, and we have subcategories within that, but we still want you to talk to us about where we can best provide funding for you and assistance along the areas of the sequential intercept model. Good point for the changes in the solicitation.
Okay, thanks, Tim. That's really helpful. And I do really actually like how they structured this. It's a lot more open-ended, and so I think it's a lot more responsive for you to be able to design what you want without feeling like you need to fit, a circle in a square peg. So here's the sequential intercept model. They still have links to the materials, and I've still provided them here in this PowerPoint. It's pretty straightforward. This slide here showing the 5 different intercepts is essentially what you need to know to take away, that when you're designing your program, where in the criminal justice process are you targeting your resources? Is this prevention? Is this diversion? Or is this, recovery support for after people are released from prison, say? So just something to consider, and, like specific terminology when we're talking about where in the criminal justice process we're targeting our efforts. A quick note on this solicitation, there is a requirement for all proposals to be open to the promise of a research component. This language looked a little familiar for me. I've been working on a Children's Bureau project under the regional partnership grants, and there they had really similar research language where different sites have done a proposal to make like a child welfare enhancement, and then as part of the grant they're doing a cross-site evaluation just to show which of the programs have were successful in certain ways, and that could they infer later down the road an evidence-based practice. In this grant, there's not any guarantee that there's going to be a research component, but it's possible. And so I think that's important to know, especially for communities that are maybe a little bit more, hold your cards a little bit closer to the chest about allowing outside researchers involved. That's something to consider here. I know many of you have your own in-house researchers, but here they definitely envision an outside research agency collaborating with the grantee. So,
hi, Lauren, another question just came in.
Yes, yes.
So you said this is Adrian, active port. Hayden, we have a COPE First Responders 1A grant, and are we eligible to apply for BJA fiscal year 2019 funding?
Oh, great question. Congratulations on your first responder grant. My understanding is yes. I don't think past grantees are ineligible. Sort of just like CTAS, where if you have a purpose area 3, you're eligible to apply for another one, whereas OVW, you're not. There they do limit on how many times you can have a simultaneous grant, or I think it's OJJDP. Either way, not relevant here, but Tim, is that right, that if you were a grantee last year, are you eligible to apply again this year?
Most certainly, and I did fail to mention in the beginning, we went from 145 million just for those categories, excluding the PDMP money, to $157 million. So we awarded approximately 185 or so grants from the last round, and we are allowing past grantees, open grantees, to apply, as long as the request is not something that's duplicative of what you already are receiving funding for. As you know, that's called supplanting. So if you have a category 1 grant and you're looking at a different category, and I don't want to use category 1s anymore because we lost those numbers, but if you had a previous initiative, if you have a grant funded program for one project or program area, and you're looking to add a different component or apply in a different section for what you currently are funded, that's certainly allowable.
Awesome. Yeah, and as we'll see in a minute, we'll show why that category language is sort of less useful now, but it's a good thing. So here we can see these are the three categories for COPE. And I've highlighted where I see the biggest bang for our buck. So in category 1, it's specifically for locally driven responses, and they've broken it up by urban, suburban, and rural or federally recognized tribe. So I'm going to guess that 99% of us are going to fall into the federally recognized tribe category. What's also exciting about this is I think it helps increase our odds, right? We're no longer directly competing against, Los Angeles and New York City, which is pretty cool. So category 2 involves statewide projects. Obviously not relevant for us as far as eligibility, but I wanted it to just be on your radar in case your state applies for and is awarded one of these programs. We want to be aware of that because they could be providing pass-through funding or at least programming that serves our community. So we want to know about those. And similarly for the prescription drug monitoring program under category 3, if our state is doing any work on this, we want to be sure that our local hospitals and clinics are participating in that. And if they're not, maybe some of our local regions are looking at pushing the state in this direction. So it's still tangentially relevant.
Before we move on, Adrian had a follow-up question.
Sure.
Asking, so is 1C subcategory another area that we can apply under? Because Tim said if we have category 1, then we can apply under another category.
So I think that you can still apply under 1C. It's just a matter of, you had that first responder grant. So if you were going to apply to say, we want to do like a parenting program for parents that have a substance use disorder, that would be fine. If you were going to apply for another first responder type grant, it would need to be substantively different than what you're doing right now. So you can't just repeat the same program because then you would be sort of double dipping for your first responder. And that's why the whole category language doesn't work, because now category 1 includes what used to be the 3 categories. So you can apply for 1C, you're eligible, just so long as it's not the exact same program that you applied for last year. Hopefully that makes sense. So let's get into a little bit of what is included in 1C. So as Tim mentioned, there's more money, which is always great. It's also for 3 years, and they anticipate these programs to be funded at around $600,000, which is great. So just broadly speaking, there's a couple of different pools of programs where they envision expanding access to supervision, which is, probation, law enforcement, anything, falling under there. Treatment, super broad. Recovery support services, even broader. To support law enforcement and other first responder diversion programs. So Adrian, this is what used to be category 1 last year. To promote education and prevention services, again, pretty broad, this could be a lot of things. And then my favorite category, addressing the needs of children. And this is the pool where I see all sorts of different opportunities. And as I mentioned, they expect each of these different pools to involve multiple agencies and partners. Now, these pools that I'm referencing, this is just something I have in my head of how I see this solicitation organized. This is all category 1C. And so don't feel like you need to identify where your proposal falls. As long as it's one of these, you're eligible, you're in. So they provide some specific examples of what they think a proposal can include. This is not intended to be an exhaustive list, nor are you stuck to just one. You could propose a combination of any of these. It's really just to get sort of your creativity going. So like the first and I think sort of the most obvious categories are those typical diversion programs, either pre or post arrest, first responder. They're really envisioning, because this is an opioid specific solicitation, they know that first responders are often the first people to interact, and especially at a moment of crisis. And so instead of, turning someone over that has a, addiction over to the criminal justice system, can we institute a different process, sort of like an opioid response team that can help link that individual with services to, aid in using that moment of crisis. Enhance law enforcement capacity to identify and connect individuals to treatment, sort of a specific take on that first responder diversion program. Here we go. Enhance responses for affected children. They have all sorts of different examples that could go in here. Embed social services with law enforcement. Break down some of those silos. Build parent and family strengthening programs, right? This could be a whole program that exists within your social services department to boost maybe some of the existing programming that they already have, including maybe bringing in some of that prevention programming that might not be there yet. Enhancing your trauma and mental health treatment. This could be within your behavioral health program. It could also be in addition to. Maybe you wanted to hire some trauma and mental health providers specifically into the court. Specialized training for serving children affected by overdose. Here, I think they mean specifically for social services. Maybe some of your caseworkers don't have a background on addiction or specifically overdose, but maybe you also need training for other institutes that serve children, such as your Head Start program or your schools. People that are interacting with children that are suddenly the victims of, either witnessing an overdose from a family member or a friend, and just need to, have some good terminology for how to handle those situations. Programming for child and youth serving organizations. This can include social services, but also those atypical, non-criminally justice-involved programs like Head Start, Boys and Girls Clubs, all of these other programs that are touching our children. Cross-system collaboration. That's pretty broad. That can be any type of program that you envision that needs to start talking to each other to help enhance our opioid programs. Super exciting. Peer recovery support. This can include, there's formal trainings out there specifically for peer recovery. Some of those are in references to true peers, those who are in recovery themselves, maybe graduates from our wellness court, but it's also in reference to a specific training for substance abuse counselors to serve as like a mentor or a case manager. And so they don't, those trainings are like certifications, and sometimes they're people in recovery and sometimes they're not. So those kinds of programs can be pretty varied in what they take. Transitional or recovery housing. Do you have any type of halfway home in your community? Do you need to build one? Maybe a partnership with HUD if you were so ambitious. Maybe just a simple program where we want to use these dollars to rent apartments for our community members that are in need of recovery housing. Court-based or family court-based interventions. Here they specifically note that this does not include healing to wellness courts. And that's because there is a separate solicitation specific for drug courts. So that's the only thing that you can't do under COPE. But as Tim mentioned, that doesn't mean that you can't work with your wellness court to build up some sort of arm that the wellness court can use. So this could include something maybe broader than the wellness court, maybe a different arm of targeting all of your parents with dependency cases, who knows. Telehealth. Do you have any sort of ITV equipment in your community? This could include with your behavioral health to provide behavioral health services remotely, including maybe for those that are incarcerated or at least in jail. It can also include maybe remote court hearings. Maybe you want to do remote court hearings for those of your participants that are in residential treatment or live in a remote part of the reservation. Drug collection boxes and permanent disposal programs, including maybe collecting dirty needles within your community. Medication-assisted treatment. Does your community just need an extra boost to get an MAT program going? Maybe you have a physician identified, but there's just not a facility or the means to really implement it. Maybe this can be sort of the impetus to get that going. Reentry recovery. Maybe your community has a reentry program that you could partner with to specifically target those with substance use disorders. Maybe there's no reentry program at all, and you need to start from the very bottom. Overdose fatality review teams. If overdoses are specifically problematic in your community, maybe having a targeted team that can be called by those first responders to help provide support both to the victim as well as to their family. And data integration. This is a big one. I know that this is a struggle for lots of communities. What type of data management system are we using? How much do our systems not talk to each other? Do we have a sense of what our community is facing? We've got all of these different entities providing services, but maybe they don't talk to each other. So those were all of the examples that were provided under just category 1. I really can't overstate how broad and open this is, that if you had a pet project that you just didn't quite know how to fit into your wellness court because at the end of the day you need to pay your coordinator and your judge, this is a really unique opportunity to start getting creative. For example, I am working with drug courts right now that have hired a nurse practitioner to serve on their team and conduct home visits. I have a team that's working specifically with the physician to work with all of their pregnant moms, providing support and care through their pregnancy, as well as supporting the newborns who are frequently born substance exposed. There are just so many different creative strategies that I think the best that we can do with this is sort of look at our wish list. What does our community need? What do we wish that we had? Are there trauma services that we need? Are there parenting programs that we don't provide in our adult criminal court? All sorts of stuff here. So I just wanted to again touch briefly on the different other categories that are out there. There's the statewide one that hopefully our states are going to be applying to. I want us to be aware of them because it can include pass-through funding that we may be eligible for, but we at least want to be holding our states accountable and being sure we tap into any programming that they're establishing. And then there's those prescription drug monitoring programs. These are specific programs that pharmacists participate in. It's intended to do a couple of things, but it includes identifying addicts who may be abused pharmacies, targeting pharmacies to get duplicative prescriptions to help pharmacies prevent when that's happening. A lot of our community members are pretty savvy crossing state lines to do this, and so we just want to improve our own data management system. Some states have been a little cool to the idea, and so there's been a lot of pressure that like, no, we want to be participating in this. The least we can do is to help alleviate some of the diversion of these prescription opioids. So just something to be aware of. Data ownership. I drew this language directly from the solicitation just because I wanted us to be aware of it. Any organization using this funding must be willing to share their data and guarantee that the agency that owns the data and its approved designees will retain unrestricted access to the data in accordance with BJA policy. This includes providing data in an expeditious manner upon request by BJA in a clearly defined format that is open, user-friendly, and unfettered by unreasonable proprietary restrictions, and at a minimal additional cost to the requester. So this is a little bit different language than what we see in, say, our typical BJA Healing to Wellness Court grant. And those grants were expected to report on performance measures that we know ahead of time, but we otherwise retain ownership of our data. Here, BJA is asking for much greater access to that data, including sort of seeing the whole data set. I don't think that necessarily means they want unidentified data. I think that there's still room to protect the confidentiality of our data, but it's certainly more open-ended than I've seen in other solicitations. Is that accurate, Tim?
Yep, that sure is.
Okay. So I just want to make sure that all of our potential appliers are aware that this language is in there. Okay, so just briefly overview the application components. For those of you that have applied to a BJA grant in the past, this will seem very familiar, which is good. It's not atypical. So we have our statement of the problem, 15%. I identified here under category 1, this was the only reference I found to the sequential intercept model, but it's there, and as you saw in the previous slide, pretty straightforward. They just want you to be aware of the model and be able to articulate where in the model your program is falling. Project design and implementation, a healthy 35%. All straightforward questions. I would say this is even better than other BJA application components that I've seen, in that they ask a relatively reasonable amount of questions to fit in the space allotted. They had a couple specific carve-outs. They wanted to know some specific things if you were proposing medication-assisted treatment, peer recovery services, specifically like the type of certification that you're going to be looking for, and then if you're serving children, the types of services to be provided. So nothing crazy, nothing unreasonable, all remains pretty open-ended. Capabilities and competencies. This was extremely straightforward. The only thing I wanted to make sure that you were aware of is that, like other solicitations, they ask for letters of support and a timeline, and it's in this portion of the application that percentage points will apply to. They also had some pretty typical carve-outs, like proposals need to be willing to work with the BJA designated TA provider. If you wanted to include your own research component, you can, and there's a whole section on doing that. It's not required, but you can, which is kind of fun, especially for any of my tribes that want to promote a tribal evidence-based program. Wink, wink, nudge, nudge. Performance measures. Here, they noticed that they're still working on developing some different performance measures. So the links that they had were to the old categories of the 1, 2, 3, 4, 5, 6. I think they're all still relevant, right? All they basically did was sort of couch the first 3 categories into just one. So I think you can rely on the content and substance of these linked performance measures. So first responder, systems level, public safety, behavioral health, those are all going to be still in category 1. So these are all linked, and they're all drawn directly from the solicitation. Finally, impact outcomes, evaluation, and sustainment. This is actually a healthy 10%, which I think is pretty good. I think they just want some thought on how you intend to sort of make this program get the biggest bang for its buck. How do you intend on measuring that you're doing exactly what you said that you were going to do, and that you're achieving what you set out to, or at least measuring how it is that you're making a dent. So just something to think about. This is typical for lots of solicitations, so nothing crazy, but it is 10%. So I do think they want to see more than just a paragraph here. And that is it for COPE. There are a couple other current solicitations that I just wanted to be sure was on your radar. And so while I go through these, think about if you have any questions that you'd like to ask Tim while we are still here. So OJJDP has 2 open solicitations right now, one specific for family drug courts. This is a great solicitation, especially for any of you that are have a family drug court that you'd like to enhance, or for those of you that don't and want to set up a new one. Really good program. We work in close partnership with the TA provider for this solicitation, and I've just seen a lot of really good work come out of here. This is also a passion project of mine. I think wellness courts and the family dependency model are pretty neat. And the OJJDP also has an opioid-specific solicitation, much like COPE, that's specific for youth. That one's due right around the corner, May 7th. But if you're already looking at this solicitation, I think that the OJJDP one is a good one to check out as well. I also just wanted to keep on the radar the Family First Prevention Services Act. This was part of the Title IV-E. This is new funding as of last year. So Title IV-E is generally for foster care and adoption services. So this is all of our social services. You'll sort of know if your tribe is Title IV-E or not. But what's unique about this is the first time they've authorized funding for prevention services. This is an area social services is not very well versed in yet. It's a huge opportunity. And so, especially if you're looking at this funding, I think this is a good time to go partner with social services, see what they're doing with Title IV-E. Maybe not, maybe this is the first time you want to think about getting some pass-through funding, even if it's exclusively for prevention services. This is kind of exciting, a whole new world. And to be fair, this is new for everybody, states and tribes. And so there's not a great blueprint out there for how to access this money or what it can be used for. It's pretty open-ended. And so I think there's a lot of room for creativity there. And finally, just our typical wellness court resources that I want to be sure you're aware of, because you are entitled to these and they are free and available to you always. Our enhancement training, our save the date has gone out September 10th through 12th. We're going to be in Palm Springs this year, as opposed to Albuquerque, because we've outgrown Albuquerque, which is very sad for my heart, but very exciting for us. We're going to have 4 tracks this year. It'll be the biggest and best enhancement training yet, and as always, it will be free, so save the date. We also have our call for workshop proposals out right now, and so if you're interested in presenting, which I hope that you are, we warmly invite you to join us. Those are due April 30th, and this is at enhancementtraining.org. I clicked the link again. How dare I? Okay, and then I'm so sorry, I keep doing that. It does not like it. Well, that really brings us to the conclusion of our presentation. And so I think with that, we should go ahead and go to any questions if we have any. Do we have any other questions, Laura?
We are caught up with questions as of now.
Fabulous. Well, with that, how do we access the slideshow? Great question. Hopefully you see it in your handout. That should be part of your dashboard. But if you don't, I am going to, right after this webinar, I'm going to post them on our website, wellnesscourts.org. So I'll post the slide deck, and I'll also post the solicitation. And then by tomorrow, we should have the recording of this webinar. And so we will also post that as a YouTube link if you would like to access that anywhere. So real quickly, these are some training events that are going to be coming up shortly. You can always find our Wellness Court publication series online, but if you would ever like a hard copy of one of these publications, you can just email us and we will happily ship you one. Here are links to all of those publications, but they're also all available on wellnesscourts.org. We have specific funding for justice and service, or Justice for Vets is our partner, but we have specific funding for veterans wellness courts. If this is an area that you're interested in, please email us because there are some exciting new resources very specific to this that were just released. So it's a really right time for that. And finally, here's our website, wellnesscourts.org, and this is where you can find all the things. And so I'll leave you with our contact information. And with that, Tim, I would like to thank you so much for joining with us and for taking the time to share this information about the solicitation. This is a really exciting funding opportunity.
Don't thank me. Thank the participants for their willingness to continue this good work. And I thank you and Tribal Law and Policy Institute for helping everybody. We know that you guys on the field are the ones who are the most deserving of the applause. Anything the federal government can do to help you, we're here to help, whether it's the financial funding options for the solicitation or the training and technical assistance, which we're working on improving for our COPE applicants. We're here. And just to let you know, it was almost maybe a 90-some percent, 92% success rate of those applicants who applied for our funding and got an award last year. So that's not enough of a suggestion. Yeah, we really encourage all folks who have a need. The administration has identified this as a top priority. And with the opioid issue, taking 140-some persons, citizens, and tribal members a day, that equates to like one every 11 minutes. And we're trying to get on top of this as quick as possible. So if you, echoing what you said, Lauren, look at your jurisdiction, look at your area and gaps of services that you've identified, and see where along the intercepts the funding can fit your tribe, your jurisdiction, your area. Work coordination and collaboration with all of your local resources and figure out a way to use our dollars to help. And that's all I have. Lauren, I didn't know if you had any final comments.
Only that a 92% success rate is unheard of. If you can put anything together in a proposal, oh my God, submit it. That's intense. All right, well, with that, thank you everybody for joining us for this webinar. I similarly applaud you. It's no easy